Ghoshal earned his PhD degree in engineering from Jadavpur University in 2014. He is currently working as Associate Professor in the Department of Information Technology, St. Thomas College of Engineering and Technology, Kolkata. He has teaching experience more than 13 years. He has organized and chaired several special technical sessions in lots of international conferences. His research interest is in the area of machine learning and pattern recognition. He has plentiful number of referred publications in international journal papers, international conference papers, and international book chapters. He has also taken important role in organizing different technical activities in St. Thomas College of Engineering and Technology. We are very much pleased that he is with us in today's session. Now I would like to request Dr. Ghoshal to start his session.
Now today I'm giving a presentation on this topic, that is COVID-19 unfamiliar facts. Now the transmission of the SARS-CoV-2. Now how the SARS-CoV-2 virus can be transmitted? Obviously the most one is the physical contact and the close contact. The physical contact, close contact means you should have the 6 feet range within the 6 feet range for 15 minutes or more time. So that means if you are greater than 16 feet range and minimum, that means less than 15 minutes, your chance of getting infection is low. So that means if some COVID-19 patient is just passed by you for a fraction of a second, there is a very less chance that you will be getting infected with SARS-CoV-2. The transmission is more likely between the people who live together. That means that's why you will find that if one person in a family is getting infected, it has been generally found that all the members of the person is getting infected with the SARS-CoV-2. Just like in our case of the Amitabh Bachchan also, that you would find that most of all the family members, almost all the family members are getting infected with this. So that means if one person in the family is getting infected, high probability that the other family person will also getting infected with this particular virus, because they are not maintaining this 6 feet distance and this 15 minutes time span. And also there's some shared environment like offices and restaurants where the 6 feet distance and for the continuous 15 minutes is not maintained. And also by sharing the food, because sharing the food means your saliva is getting transmitted from one people to one other people. So if your saliva is containing the SARS-CoV-2 virus, so obviously it will be getting transmitted in the other person also. Actually, these two ways the SARS-CoV-2 can be transmitted. The first one, it is a direct way. That is that infected people will have the virus in their mouths, nose, and throats, and when they are laughing, talking, and coughing and sneezing, that time this droplets is coming out from their mouth and it can travel up to 6 feet distance. That's why it has been already guided by the governments and WHO or CDC. They are saying that the social distancing of 6 feet has to be maintained because the droplet can travel up to 6 feet. So this is a safe distance, but it cannot be said that if you are beyond the 6 feet distance, you will never get infected. No, it is the general situation. These droplets can enter into the person's mouth, but the solution is just to protect from these droplets, you have to wear this mask. The second way, that is an indirect way, that means suppose I am infected with SARS-CoV-2 and no other person is surrounding me. So suppose I have sneeze or I have coughing and this virus, these droplets have come out from my mouth and it has been resting into the surface. And you know this virus can survive on the surfaces for a long time on different surfaces, different time spans. Now suppose it has been active or it has been surviving on a particular surface and another person puts the hands on that particular location because it is not visible. So without knowing anything, another person puts the hands on this particular area where the virus is currently surviving. And later from the hands, it can be transferred into the mouth, nose or the eyes of that person. And get rid of this one, the frequent hand washing and the cleaning are very much required. That's why it has been said by the governments and the different health organizations, they are saying that the frequent hand washing and the cleaning is very much required. Now, how to wear this mask? Because when we wear this mask, anybody you will find in the streets and in the roads or nearby that they are somebody is wearing it's different way. But the CDC is guide. The CDC means the U.S. Centers for Disease Control and Prevention is giving these guidelines that you should wear the face cover, covering the nose and the mouth to protect the others. Because mask can protect you and the other person. And don't put the face cover around your neck or put it on the forehead, or you cannot put it into your chin. And don't touch the face covering. If by chance you have touched the face covering, you have to sanitize your hands. Obviously, this mask is our primary protection, and you have to wear this mask. And many times you will find that the people put it down into the chin, and this is not the right way, because your chin, whenever you are wearing this mask, your chin is already exposed, and obviously lots of virus and bacteria is lying on there. Fine. Now, whenever you are putting down your mask inside there, this is getting put into the inside layer of the mask, and whenever you are just putting it up again into your nose, all these virus and bacteria are getting transmitted in your body. So don't put down your mask into your chin. Why the stopping transmission is very much important, because you know that if this particular virus is getting infected, is infecting one particular person, and on the say incubation period, if another person is getting infected, he will also show the same types of incubation period and the next 10 days signs and symptoms. To stop this transmission, who are infected, that need to be traced. That is the most important thing. And the number of people they are contacted need to be also be limited. That means those people who are infected, their contacts, that means who are getting infected, who are among the who are in the near about of this particular infected person, that needs to be limited, because otherwise you cannot control the spread. But it is very difficult, because after being infected, you have a very less time to be good situation, in the good situation, because it is after a very short while, after 5 days or something, or sometimes you will started to feel ill. Now, window of opportunity, it is a term that is being I am explaining there. It is an opportunity that when the particular person is getting infected and another person is getting infected from that particular person. So after I am getting infected, I will develop, suppose I have got infected from the other person, and I will obviously show the infection within the 5 days time span. Right? And you know that before 2 days, that means whenever I am showing the signs and the symptoms, before that day, 2 days before that day, I have got infections. Fine. So actually 5 minus 2, that means 3 is your window of opportunity. Within that particular day, you have to trace all the contacts who are exposed to the particular COVID-19 positive patient. And whenever within that time period, you need to be warned to those contacts, to those people that you were exposed with the particular person, but without revealing their identity, but need to control the spreading of the other person. That means contacts with the other persons need to be minimized. Next one, that is a reproductive number. Reproductive number means that the number of people one infectious person will infect everyone. That person has a contact which is susceptible. That means it is very easy to say that how much number of people is getting infected from a single person. That is called as a reproductive number. And this higher the reproductive number, more people will be infected, and the disease will be more infectious. Just see this comparative diagram. The first one, that is the COVID-19, next one is the influenza, and the third one is the MERS. For the COVID-19 and influenza, this reproductive number is ranging between 2 to 3. And for MERS, it is less than 1. But the most infectious disease in the world is the measles, where this reproductive number is 16. So that means one people can infect maximum up to 16 number of people. So it is most dangerous. Now see that if the reproductive number is 2, as it is between 2 to 3 for COVID-19, I am assuming that it is 2. Now in the C, that the first person who is getting infected with this COVID-19 is spreading it into the 2 persons, and each of these 2 is again this 2. Again, each of this person is infecting this two. So that means if you are transmitting in the 4 layer, that means in the 4 stage, you will find that a total 15 number of people are getting infected with this COVID-19. So that means within a very short while, a huge number of people will be getting infected. Though it is, you were saying, you can think of only 2 people, so that's fine. But this two can range like this. From 1 people, 15 people will be infected. But if you can just restrict it to only one, that means the one wing just cut off, you see that in the 4 stages, it will be infected only 4. So the spreading of this disease need to be stopped, because in a one single stage, if you can stop this one, you can control this disease to be infected from the different n number of peoples. Now this contact tracing or COVID-19. Actually, contact tracing means that those people who were exposed to the COVID-19 positive patients, they are in the chance of the next COVID-19 positive. So those people need to be traced. Their activity should be restricted. That means they should not be allowed to. They should not be allowed to meet with the other people's. Their activity with the social activities will be restricted. All these things you need to do. That is in the part of the contact tracing. So diagnosing this one is very important. Now the person who is already infected with the COVID-19, you have to ensure that the medical and the social service is being reachable to that particular person. And also you have to limit its contact with the other people. Similarly, who were being maybe infected, that means who were exposed with the COVID-19 patients, you have to notify them about their exposure. But you should not disclose the identity of the people who is COVID-19 positive. And also, you have to limit their contact with the other people. To limit the contact of the other people, initially lockdown was imposed. But lockdown was imposed in the 2 reasons. One is to limit the activity of the people of the contacting with each another, and also to develop your health infrastructure. But it was in the initial phase. Lockdown was required, but now this time lockdown is not so much effective. And obviously, what you require 2 terms, your 2 actions. Those are isolation and quarantine. You have to do those things. You have heard these terms. That is a case and contact. Case means that someone who is already infected with COVID-19, that means who is COVID-19 positive. Generally, they will be having the positive test result, or they have developed the symptoms, but they yet not being confirmed with the positive test result. And the contacts means those were exposed with the COVID-19 positive case during their illness or 2 days before their illness. It can be maybe there's physical contact, maybe the close contacts who are within the 6 feet distance for more than 15 minutes. And the proximate contacts means who were more than 15 feet, or more than 16 feet distance in the same room for an extended period. That means suppose in the same room, one COVID patient is there, but I am maintaining the distance of more than 6 feet, suppose 10 feet or something like that. But I were present in the room for more than an hour. So I am the contacts. Though I have maintained the minimum 6, I have maintained the minimum greater than the minimum distance, which is 6 feet. Next terms, that is the isolation and quarantine. Many times you will find in the paper that isolation is required, quarantine is there. So what is this isolation and this quarantine means? Isolation means that keeping the sick people separate from the healthy people. That means those, it is applicable for those who are already COVID-19 positive. That means who are already infected with SARS-CoV-2. You have to restrict their movements inside their home or hotel or any separate space into the hospital to limiting their contact. And it is at least 10 days duration after showing their symptoms. And obviously you should maintain that the symptoms have to be deteriorated on that gradually. And the last 3 days there should not be any fever. Then you can come out from the isolation, not before that. And quarantine means it is applicable for the contacts, that is those who were exposed with the COVID-19 positive case, and you have to restrict their movement and the contact of the healthy people from the contact of the healthy people who were exposed. You have to restrict their activities or restrict their movements, and it is generally for having the 14 days duration. How long, it is obviously a question, how long you should be isolated from the others. Ideal answer is that as long as you are infectious, but practically it is being monitored that your situation is gradually improving. That means your symptoms are gradually decreasing, and at least 10 days after the symptoms. That means that when you are reporting the first day of the symptoms, after 10 days, it is being observed that whether your symptoms is getting improved. That means some symptoms has been gone, some symptoms intensity has been deteriorated, and in the last 3 days you are not showing any kind of fever. Then you can come out from the isolation. The infectious period like that, suppose it is an example that I am calling a particular person who is already a case, that means who is already COVID-19 positive on May 10, and the person is reporting that the person is have become ill on May 9. So obviously your infectious period started 2 days prior to there. If you see there that on this 9 the person was felt ill, and it's 2 days before the person was infectious. Fine. And from this 9, as the symptoms has been developing, 10 days after this one will be the infectious period. So this 9 plus 10, that means May 9 plus 10, that means May 19 will be the end of the infectious period tentatively. But it is subject to the constraint that your symptoms is getting decreasing, you should not have any fever like that. Next common question, that how long should I be in the quarantine if I am exposed with a COVID-19 positive case? Ideally, again, as long as you can be infectious, that means the risk factor is there. But the actual answer is, for the longer term, you can say that the 14 days you have to maintain the last 14 days gap from the contacts who have been identified with the COVID-19 positive. But to whom you were exposed, the identity of the COVID-19 positive case should not be disclosed. Now, this is the 6 steps to investigate the cases and for contact tracing. First, you have to introduce that you are from the health department or something like that, because only those departments have the legitimacy or they have the right to do this contact tracing. Next, you have to inquire that whether the infectious period, what are the current stages, identify the contact segment. You have to ask the COVID these cases that who are the people who are exposed to that particular person. You have to isolate the particular person who is already COVID-19 positive. Initiating, then that means whenever you have got the information, that means who are the contacts, that means who are exposed with the COVID-19 positive case, you need to initiate the contact tracing. That means you need to find out them and you need to warn them that they are exposed with the COVID-19 positive. And you have to implement the regular check-ins. That means you have to monitor all the contacts and all the cases. That means for a single case, there might be n number of contacts. And like this way, it is a huge thing. And obviously you require a technical support for that, because otherwise manually this task is not possible. Now, contact tracers, that means when you are asking about the contacts, you have to collect all the information in detail. That means the total information you require, like location or the type of the interactions, that is whether you have made with in a home or something like that. The contact information for the venue, names of the close contacts, and this contact information is the specific information or the venue, that means the specific information like the flight number. Suppose you were suspected that you were informed that a particular COVID-19 patient was in your flight journey. So you have to inform what was the flight number, etc. All these things. So that means because at that time, suppose I was infected with COVID-19, and whenever I done this travel, I have no idea that I was in the COVID-19 positive. But after 2 days, I have showing some symptoms. So I am becoming the case. So that time I am reporting that I have traveled with a particular flight number. So all the particular concerned airlines will be informed that who were the passenger list, what were the seating arrangements were there. And from there it can be traced that who were the people who were sitting nearby to me. All this information need to be traced. Even the movie name that was from the movie hall, that can be also traced. Conference names, class name, facility, etc. That was all this detailed information where you were there and who were surrounding with you. All this details information need to be there. This importance of this contact tracing is required because it is a public health intervention tool, and there is some past history that this contact tracing can be possible. to solve any pandemic or any epidemic. Previous examples are already there, that is syphilis and Ebola. All these two epidemics were being controlled by this contact tracing. So contact tracing is the another great help to fight with the COVID-19 and to control and to prevent the spread of the COVID-19. Now, identify the high risk some situations like the dense contact environment, that means where the large crowd of the people are living inside a very small area, that also increasing the risk, like conference, mass transit like bus, tram, metro, train, etc. Religious services like in a temple, mosque, or etc. Some demonstrations, some political parties, maybe workplaces, bars, gyms, schools, sporting events, any concerts where a large people is gathering for a not 24 hours, but it is for a long time, that means which is greater than 15 minutes, and you are gathering a large number of people within a very short, within a very small location, because they are not maintaining the 6 feet distance for the distance gap, and also for the 15 minutes. They are maintaining a less than 6 feet distance and greater than 15 minutes. So they are in the increasing risk. And if that type of situation is arriving, they are becoming the super spreader. And this super spreading situation can happen in a dense contact environment, just in the slums. That's why, like in the Mumbai, the Dharavi slum, it was being in the fear that as it is a very much dense population in there, so it can be spread in a huge way. Next factor that can increase the risk is the difficult to contact trace and identify the exposure. That means the close contacts may be unknown. Just like if you're traveling with a bus, you don't know that who are the people who are standing surrounding you. It's not possible. Then also sometimes if you are asking in a person, in a just like me who is traveling inside a bus for a particular time, I cannot recall all the close contacts because I don't know them. Even in the slums also, that means or in the homeless shelter also, they may not recall all the contacts. That means all the people who were nearby that particular person. So it can be spread throughout the multiple. Also, it can happen. The contacts are spread throughout the multiple jurisdictions. That means sometimes, just like you see that you were traveling, you were in a local train, and the a number of people are surrounding you, and it may happen that even if you can identify those contacts, those people are living, some person is living in some other district, some person is living in some other district, so it's becoming very tough to identify them. Another risk factor is difficult to isolate or quarantine. That means just like in the slums, in the Dharavi slums, they were also pairing up like this thing. Isolation means it is a completely separation from the others' activity and completely separation from the others' people. So it's become very tough if your area is not permitting. Also, your distance from the others is not like that. And some people you will find also there that they are unwilling to cooperate.